Now, the first time you saw Mr. Perry was on September 8th, 1999, correct? That's correct. You had never seen him before? Never seen him before. Okay, by the way, are you familiar with the American Nursing Association? Yes. They offer certification also, correct? Yes. You don't have that either, do you? No, I do not. Are you familiar with nurse practitioners? Yes. There is a difference between a nurse practitioner and a registered nurse, correct? There is a difference. Nurse practitioners can prescribe medication under the supervision of a doctor, but can prescribe medication, correct? That's correct. Plaintiff's counsel, objection, putting words in the witness's mouth. If Your Honor, please. The court, overruled. This is cross. Proceed. You are not a nurse practitioner? No, I'm not. Now, you recommended a change in withdrawn. You observed the skin on plaintiff's buttocks, scrotum, and left foot, correct? That's correct. Plaintiff's counsel, what date? Just so we have it right. Defendant's counsel, on September 8th, 1999. I think it's Exhibit G we can go to. You observed on the foot a 3 by 2 by 1 centimeter deep, what you termed a stage 3 ulcer with a pink base? Yes, I did. Okay, when you did this examination, did you look at any other records from any of the previous examinations of the foot in the home from August 31st to September 14th? Did I look at any of the other records? Yes, I don't recall. The court, try to refresh your memory. Defendant's counsel, thank you very much, Your Honor. But I can tell you, when I go in, I usually just do an examination of what I see. Yes. So then, if you don't look at the other records, you don't know whether the wound has been increasing in size, decreasing in size, gotten better or worse because you're doing your examination, correct? Can you say that again? That's a logic thing. When you see a wound for the first time, you are seeing it for the first time. Is that right? That's right. The court, all right, she's seeing it for the first time. So I usually go in and I don't know what any pre-existing knowledge of what happened is when what was there. I just need to see what I see on the spot, and then I made a joint visit with the nurse. I'm sure she verbally told me what was occurring with the wound. Is it your testimony that you did a joint visit with Nurse Flame? Yes. And you knew who Nurse Flame is? Yes. And you discussed your findings with Nurse Flame at the time? Yes. Would you be surprised to know that the records show that you informed her by telephone because she was not there at the time? Plaintiff's counsel, leading and suggestive. The court, the form is bad even though it is cross. No, I don't remember, so she was not there at the time. Now, do you think maybe a nurse's aide was there at the time, a Jane Edwards? I don't recall. Okay, now, you saw a slough, is that correct? The court, what is your question? You saw slough present. I saw slough, yes. Okay, please, what is slough? It's dead tissue. Okay, you did not see a necrotic eschar there, did you? No, I did not. Because you wanted to prevent a necrotic eschar, is that right? That's correct. The court, had you seen a necrotic eschar, you would have noted it, right? I wrote it down to prevent the court. But if you would have seen it, I would have noted it, of course. The court, go ahead, counselor. Now, ma'am, as a registered nurse, not a nurse practitioner, not a doctor, it is your job to execute the medical regimen as prescribed by a licensed physician, correct? Say it again. As a nurse, a registered nurse, yes. Your function in terms of health care generally and particularly with regard to Mr. Perry on September 8th, 1999 was to execute the medical regimen prescribed by a licensed physician, correct? No, that's not correct. As a registered nurse, you are taught and trained to question any orders that you may receive from the presiding physician. Okay, so you can question an order and you can execute an order, and that's it, correct? You can question an order and execute an order. You can't change an order, correct? No, you can't change an order. You can make a recommendation to change an order. Fair enough. The court counsel saved the commentary for later. Because otherwise you'd be acting outside the purview of what you are as a nurse, correct? I would never write a medical order. I would only make recommendations, obviously. You did more than that here, didn't you? You instructed in using hydrogel and in using a catheter. Isn't that true? A catheter is a nursing intervention. You don't need a medical order as a nurse. That's also known as a Texas catheter? Correct. That's because it's big, so they named it after Texas, correct? I have no idea where the name originated. It sounds good. The court, well, you talked a moment ago about nursing discretion. There are certain practices that you have discretion over. So, for example, if you were working in an institution, meaning a hospital, you could go back to the nurse's station and say, why don't we use a larger Foley catheter or a smaller one, and you have the discretion to exercise without the doctor's presence. Absolutely. The court, that's what she's talking about. So when Mr. Perry did have the Texas catheter on and you instructed the use of a Texas catheter, that was within your purview as a nurse? Absolutely. Did it ever occur to you that there might have been a reason why the Texas catheter was not in use?